This is a huge day for obviously all of West County. Given the turnout that we have today, I think we all acknowledge that. It's also a huge day in the life of the county, in the life of the health department, and particularly in the life of our staff and our patients who've been getting care all of these years at the Richmond Health Center. You may know that we've been trying for a little over 15 years to replace and rebuild the health center. And finally, everything came together. The stars lined up, ranging from some funding from the federal government, which I'll talk to you about, the availability of land here in San Pablo in close cooperation with the San Pablo City Council, and a number of other partners who've helped us move in. This is a 53,000 square foot building with over 58 exam rooms. We currently see at the Richmond Health Center about 7,000 patients a month. This is, as those of you who've walked through know, that the upper level is primarily family practice. We also, however, offer a full range of specialty services here: ophthalmology, ear, nose, and throat, gastroenterology, surgery, oncology references, the full range of medical specialties that are needed, and particularly prenatal care in our Healthy Start program to get mothers off on the right foot and to follow them all the way through to their deliveries. So this is an extraordinary day. I do want to, first of all, acknowledge the partnerships that have gotten us here. First of all, Doctors Medical Center right next door. We look forward to an intimate partnership with that facility, particularly with regard to the patients that we share. And with added help from John Muir, we have a $1 million grant over the next year to really fully implement a close cooperation between our outpatient center here and the Doctors Medical Center Emergency Department. That will enable our patients not only to get appropriate follow-up care when they're seen in the emergency department, but also teach patients that they can actually get a lot of care here and avoid an emergency room visit. So we really look forward to that partnership, and we especially acknowledge the folks from Doctors Medical Center who are here with us today. We also acknowledge our partnership with Lifelong Brookside, the Community Health Center, which is right next door. Even as we expand primary care here, we still are way behind the 8 ball in terms of meeting the primary care needs for West County, and working with a close cooperation and partnership with Brookside will be really crucial for our success here. We really look forward to a much better, closer relationship with them. Kaiser Permanente has been a partner in so many ways, particularly with regard to our public health interventions over here. We are now in a partnership with them in what's called the Triple Aim, working on the general health of the entire folks of West County. If you figure the number of folks who are enrolled in Kaiser, nearly 50%, another 20% get their care here, pretty soon we're taking care of a large majority of folks in our outpatient clinics here, and can really look then to the full implementation of community-based prevention work, which is really what this is all about. Really keeping folks out of the clinic if they don't need to be here, out of the doctor's office, and particularly out of the hospital. So we look forward to that partnership as well. A person who's not here, he's actually on a cruise with his wife, is Pat Godley, my Chief Operating Officer, Chief Financial Officer. Pat's not prone to public acknowledgement, but I really want to acknowledge the full-blown effort that he's put behind this rebuild over the last 10 years, and particularly our successful application to the federal government for the initial funding that got this off the road. You need to know that as part of the stimulus funding under the Obama administration, we were successful in applying for and obtaining a $12 million grant as a down payment to get this up and going. Supervisor Joy and our entire board were supportive of that, but I particularly want to acknowledge Congressman George Miller. George, as you may know, was able to pull some strings for us, and I think was crucial in helping us get that grant. So without further ado, I'd like to introduce Congressman George Miller.
Thank you, Dr. Walker. Thank you so much for your leadership to the entire health department for its leadership, for its service to our communities. This is a wonderful day. Irma Anderson and I were talking, walking up the stairs, how long we've been part of the debate, and she working in the service all of these years about how we were going to provide first-class health care services to West County. And sometimes it was a knockdown debate in the Board of Supervisors and the state legislature and the city council chambers and even to the Congress of the United States over the last 40 years. But it was a debate that was worth having because today what you see the results of that, where we have a fully integrated healthcare delivery system with a first-class clinic system between Brookside and this clinic and replacing the Richmond Clinic. And I want to thank the City Council of San Pablo for being so welcoming to this concept and to the City Council. And both of this is past and present councils of Richmond for understanding that this is a major upgrade in the healthcare services that people in West County are going to be able to receive. Today you're looking at the future of healthcare in America. You're looking at a comprehensive clinic system so that people can get the health care they need immediately when they need it. They can get it in real time. And that information can be shared with whether it's John Muir or Kaiser or Doctors Hospital or some other service, and it can be done electronically, saving money, driving down the cost of health care. That will all be available here today. That was a vision that President Obama That is the vision that President Obama brought to the health care debate, the legislation that I was very honored to write, absolutely honored in my entire public career to be one of the 4 co-authors of that legislation in the House of Representatives, envisioning this kind of care, this integration of care. Many of us have been to the clinics when they're just jammed with people. They don't have the resources, but people need their services. Whatever the concern is in the community. We just went through an episode in West County with the explosion at Chevron where people were seeking those services, seeking information, seeking knowledge, seeking treatment. Now we have the ability to expand the services to those people. Hopefully no more explosions, but we have the ability to serve the community, whatever drives them through the front doors here, emergency or routine care. And what happens when that happens? And what happens when you have a national comprehensive plan? It means for the first time in this country, no matter what happens to you the rest of your life after 2014, you will not lose your health care. And no longer will a woman, no longer will being a woman, you guys listen up to this. No longer will the simple fact that you're a woman be a pre-existing condition that is used to deny you health care over and over and over again. We see small businesses expanding health care even today, even last year, because of the increased tax credits. Finally, comprehensive, accessible, and affordable health care is coming to America. It only took 100 years of debate in this country to do it, but it's coming. And this clinic is an integral part of that. It's an integral part of that. We just got an opportunity to run a quick run through the clinic here in the last few minutes. And when you get your chance to do that, I want you to look at this. This was built by local labor, on time, under budget, under project labor agreements by the citizens of Contra, Costa County. It's being staffed by our magnificent medical staff of the county and our communities, of professional people who deliver some of the best health care in the nation, who are leading the way in the implementation of many of the innovations that are now being called for in the new Health Care Act. It's the artwork by local artists, young people, other people, local artists. Hell, even the coffee is from Calahula Coffee. Now, we want to talk about local. We're getting local here. But I wouldn't miss this day for anything. And because this is where we set the pace in Contra Costa County. This is where we set the pace in West County. This is where we set the pace in the cities of West County for the care of the citizens. And I want to thank all of my colleagues who are elected officials who have struggled with this at every level of government. They've served sometimes on the board, sometimes in the county, in city government, state legislatures, and it's very important because that's a wealth of knowledge. We're allowed to embrace this in a very quick fashion. When President Obama wanted to kickstart the clinic system in this country with $1.5 billion, we were able to be there with the plans ready to go, and we're here today as a result of that. This was accelerated, this was fast-tracked, and it's here for the citizens of West County. So thank you so very much for being part of all of this. And finally, I would just like to pay a tribute to a mentor of mine in public health care policy, and that is the former county medical director, George Degnan, who served this county so very well for so many years. And I'm so delighted of the leadership that we have with Dr. Bill Walker, who comes to Washington so very often to run tutorials for those of us in the Congress on how it should be. Not necessarily how we want it to be, but how it should be. And he's done a great job. Thank you so very much, Bill, for your leadership.
The bulldog way in which John Gioia has taken on this project for the past decade through all of its ins and outs, and finally to be here today to see it happen is an extraordinary day for John. And I want to thank him personally for his leadership.
After working with many others for 10 years to help attract the funding and find the location for this health center, we finally have a brand new state-of-the-art public health center that West County deserves and can be proud of. You know, with the opening of this health center in San Pablo, Contra Costa County is continuing its long and successful tradition of making the highest quality health care accessible to our community. You know, many people don't know this fact, but our Contra Costa health plan, which is a health care coverage plan that serves about 100,000 people, was the first federally qualified, state-licensed, county-sponsored HMO in the United States of America. And in establishing this health plan back in the early 1970s, we're fortunate that Contra Costa's political and health leaders understood the importance of providing quality health care to the greatest number of people. So as Congressman Miller said, while we fought 100 years to get health care reform, folks in Contra Costa started that in the early 1970s. And I think that model, bringing to this county the best health care system around, is leadership. And I appreciate all those early leaders from the 1970s who helped make that happen. So, while the past is the past, this new health center symbolizes this county's continuing commitment to making quality health care accessible to everyone. And just as importantly, we're committed to reducing the health inequities that exist among people of different races, different ethnicities, and different income levels in our community. Yeah, we can applaud that. And let me just say, this commitment is shared by our board and by all of our health department staff. And I want to acknowledge Dr. Walker's leadership over the past few decades of our health department. He wanted to be here in 2014 when healthcare reform was implemented. He wanted to see this last health clinic built, and we appreciate your leadership, Dr. Walker, over all these years. And, you know, this new center will allow the county to improve access to high-quality health care in partnership with other healthcare providers here in West County. Doctors Medical Center, Kaiser, Lifelong Brookside Medical Clinic, and Planned Parenthood, all of whom are great providers here, and we appreciate them. You know, some of you may remember, we first heard from the White House, I think it was December of 2009, that we were awarded this $12 million federal grant to replace our aging health facility. And it took an amazing team effort to get this project designed and built in only 2.5 years. Hear that? 2.5 years. The health department staff worked feverishly. I know Pat Godley and others who are here today to write a grant application that could compete against applications from all over the United States. And Congressman Miller strongly supported our application and deserves our thanks and appreciation. And I appreciate, and they're all here today, my colleagues on the Board of Supervisors and our County Administrator David Twa, because they understood the importance of this clinic to our community and unanimously approved the financing plan to build this health center. And I want to acknowledge here today's Mary Pifo, Federal Glover, Karen Mitchoff, Candace Anderson. I really appreciate, and David Twa, because remember, this had to be a financing plan with local dollars that we approved. And I want to also especially acknowledge the San Pablo City Council and City Manager who strongly supported our efforts to build this great facility in their great city. They fast-tracked the transfer of the land and the approval of the project so we could meet the very stringent federal guidelines and federal timeline to start construction. And I want to acknowledge them, and the mayor is going to speak later, but Mayor Cecilia Valdez, Council members Genevieve Garcia Callaway, Leonard McNeil, Paul Morris, former council member Arturo Cruz, and current council member Kathy Chow. Thank you all for your great support. And as you look out over this, San Pablo's vision, which we hope to be a catalyst for, is to turn this into a medical services complex. And we support that, and we know that this will help. You know, it's hard to believe that the groundbreaking was only 16 months ago. The men and women of the Contra Costa building and construction trades, Turner Construction and its subcontractors, and our own General Services Department and Health Departments worked very, very hard to make sure that this was built in record time. And I want to acknowledge specifically Rob Lim and Steve Harris with Health Department and General Services for their effort. And you know, but our commitment to high-quality, accessible health care doesn't end with the completion of this building. When this center opens to patients, our hardworking and committed health services staff will be providing the best quality care to all those who walk through the front doors. And I want to ask every single member of our county staff in health services or who works in this clinic to stand up, and I want to make sure you all get a hand. You know, because it's our great doctors, our great nurses, our lab techs, our social workers, our financial services staff, our administrative staff, our groundskeepers, and our maintenance workers, and most of them live here in West County. They're going to collectively provide the highest level of service that our community expects and our community deserves. And I want to express appreciation to all of you. Finally, you know, this health center is going to serve as a medical hub to the thousands of West County residents, and it's going to have the capacity to meet the newly insured patients that we expect to serve under federal health care reform. And make no mistake about this, we strongly support federal health care reform. We support that in this county. We are ready and willing to take on the new insured that are going to come for service. Each patient who enters this center is going to walk by a plaque. I don't know where that plaque is, but it's out there. We're going to show it later. And that plaque has a quote from the Constitution of the World Health Organization. And what it says, "The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition." Quality health care is a right that all people deserve, and I've been proud to be part of working with many others to help make this a success. So I want to thank you all for coming, and what we're going to do as the last item, we've been fortunate in Contra Costa to have a great legislative delegation in Sacramento that has supported us on our health issues in Sacramento, along with the great support that we've gotten from Congressman Miller in Washington. So I'm going to ask, I think State Senator Hancock is here with a proclamation, a resolution. So I'm going to ask State Senator Hancock. I see Senator DeSaulnier here, who used to be on our board, Assembly Member Nancy Skinner, and I want to acknowledge Susan Bonilla and Joan Buchanan. So if I can ask the state legislative folks to come up. I think, Lonnie, you had something briefly. There you are. So just coming up, and because it's with their leadership in Sacramento that we're able also to access more funding. We appreciate that. Thank you all for coming, and in about a month when this opens, we look forward to serving the community.
All I can say is we in Sacramento salute you. You guys have done a tremendous, tremendous achievement. Your passion, your commitment, your ability to work together, public, private, across city lines, county lines, federal lines, the leadership of George Miller, John Joya, all of us. We have built together a beautiful, beautiful building that shows respect for the people who come for service, for the people who work in it every day, for the community. And I just have to say, folks, this is what government is. This is what government at its best does. It allows us to pool our money to buy together what none of us could afford to buy as individuals in this beautiful place. So thank you.
John took my time up.
No.
John.
All right, let's have our picture.
I do want to acknowledge we appreciate our relationship with all in local government, and I see representatives here from the cities of Richmond and Hercules, Pinole, the school district, the college district. We appreciate all of you have been great champions on healthcare, and we really appreciate that.
No. Just one last thing. I don't know if anyone else is going to mention it. This is a LEED certified building. So this is gorgeous in every possible way. Bread and roses.
To build a building like this, you have to have land. And I want to have Mayor Cecilia Valdez come up and say a few words, particularly with regard to the partnership that we developed with the City of San Pablo.
Hello to all of you, and thank you all for being here on this great day. And I want to say, as a city, we are very, very proud and excited to have the newest Contra Costa Health Facility here in San Pablo, just a block away from City Hall, and easily accessible from all parts of the city. And I want to give you a little bit of history about the health condition of our city residents. In 2010, at 52.4%, San Pablo had the highest child overweight and obesity rate in Contra Costa County, the third highest rate in California. San Pablo also has one of the highest rates of diabetes and asthma amongst our population. To address this, the city adopted a health element in our general plan last year, and it includes goals that we're working on to address the disparities in our community. Access to adequate health care is among the top priorities, and this center is part of the solution. Thank you. So I'm going to skip a few paragraphs because I think you've already heard that. But I want to say that I'm also very proud that this is built in record time, and we're very proud to have been part of the process to help it speed it along, and that's very much due in part to our city council and to our city manager, Matt Rodriguez, who's here, and to our staff whose dedication to fast-tracking this made it happen, and here we are today and seeing the results of it. I was going to say this is the first LEED Silver certified building in San Pablo, but you already heard that. And so I want to say we look forward to a continued partnership with the county on future development of the remainder of this site. In total, we have over 15 acres. And we see this medical center as being the catalyst to future development of a larger medical campus. And I promise you that our city council and our staff will work diligently to make that happen. So keep an eye out for the rest of the development. As I said, I wanted to thank our city manager, Matt Rodriguez, again for his dedication. And our staff, I see some of our staff. If you would raise your hands to let everybody know where you are. Tina Gallegos, I see. And our city treasurer is here. I'm sorry, I'm going blank. But she's right there. Raise your hand. Raise your hand. Yeah. And our finance director, Bradley Ward. And who else? Who else, Matt? Who else is here? I see Paul Morris is here. Paul Morris. Genevieve Garcia Calloway is here in the second row. Our newest city council member, Kathy Chow Rothberg. Vice Mayor Leonard McNeil. And, so I see Antonio Medrano, who's with the West County School District trustee. And Maria Alegria, former mayor of Pinole, she's here. I know there are other city council members here, but she's the one I see right now. So I also want to thank Supervisor Joya, Congressman Miller, Contra Costa Health Services, Turner Construction, the San Pablo Planning Commission. I know some of you here, you're here in the front row. Thank you, and our community members for their input throughout the project and their support for us going ahead and building this medical center. So thank you very much for being here. Thank you.
It took leadership and effort to bring this Silver LEED certified, environmentally friendly building in under budget and on time. I'd like to introduce Greg Fury of the Contra Costa Building and Trades Council, who signed in blood to make this happen.
This is truly one of those really great occasions, but you know, this would have never happened without the City of San Pablo and the Board of Supervisors and the staff all working together. They got the permitting together in 4 months, which is really unheard of in the construction industry. But as you can see, with what Congressman George Miller said, you got a quality project on schedule, on under budget, and more importantly, done safely with good quality, local union building trades men and women from Contra Costa County. We were also able to put a lot of young people to work as well. We have the California State apprenticeship programs, and we want to thank specifically the Board of Supervisors for investing into local workers, because we've had a project labor agreement in place for 10 years, and this is one more of those crown jewel projects. It's, like I said, 10 years on schedule, on budget, and done safely with local people. So we very much appreciate that. But like all good things, there was only one negative thing about this whole project, and like all good construction projects, they had to come to an end. But since we have a vacant lot across the way, and Congressman Miller is pretty good about twisting some arms, I think we can get some more federal money and put some more people to work. What do you think? But even after we finished all this project, like Supervisor Joya said, we're in really great hands. We have all of the union workers from Local 1, the California Nurses Association. You're in good union's hands, and your parents, your mothers, your fathers, your daughters, your sons, your aunt and uncles, second cousins will all get first quality health care. So we're looking forward to building a new facility out here, on schedule, on budget, and thank you very much.
And last but not least, today's effort is not simply about budget or architecture or design. At the end of the day, it's about patients and families. I really want to introduce our Chief Executive Officer, the Contra Costa Regional Medical Center and Health Centers, Anna Roth, who lives, breathes, and models our commitment to patients and family.
So this is truly a great day. Thanks so much, everyone, for joining us today. I would like, again, to ask the staff from Contra Costa Health Services to stand again, because I want to make sure that I get a good look at this and that you know that I'm personally thanking you. So if you could just stand up one more time. Thank you. Thank you. Fantastic, fantastic work on the part of the staff. And I can't wait until you all have an opportunity to go inside of the health center and see all the work that they did. I, too, want to thank Turner Construction, Holly Peterson and Snyder for the fantastic work that they've done on this beautiful building. It's a building that our community deserves. It's a building that's going to help us deliver the right care at the right time in the right place to everyone, because our community deserves that. I want to thank the Board of Supervisors for your incredible leadership. This has been a debate. There's a larger debate going on across the nation, and the debate is not over. So today we celebrate, tomorrow we go back out and we take that debate up again, because we have to make sure that health care improves in the United States of America. And today, this is a representation of what it can look like. I want to thank Congressman Miller for his incredible leadership, and I really want to thank Bill Walker. It's truly a privilege to work with Bill. I do know that Bill has spent a great deal of time making sure that all of the vision from people. Actually, he was mentioned today, Dr. George Dagnan. That vision continues on today, and Bill really has been a champion and a guardian of care in the community, care placed in the community, and doing common things uncommonly well for our community. So for that, I really want to give Bill a special acknowledgement and a hand for all he does. So I'm actually standing between you and the building and refreshments and music. And so without further ado, I actually would like to ask Supervisor Joy if he would do the honor of actually cutting the ribbon and opening the building officially for us. Thank you all, and please join us inside. Thank you.